Hi, I'm Dr. Dawn Nolt. I'm a pediatric infectious disease doctor at OHSU Doernbecher, and my daughter was also treated at OHSU Doernbecher Children's Hospital. And I'm here with Krista and Shelby, whose stories you would have seen on television and social media. And their children, Jordan and Bennett, have spent a lot of time at OHSU Doernbecher Children's Hospital. And we're here to learn more about their experiences and how they navigated their medical crises. So if you could introduce yourselves.
My name is Shelby Zado, and my son was Bennett, and he was born with acute myeloid leukemia, and we spent 5 months in treatment at Doernbecher Hospital, and then of course he had a bone marrow transplant, follow-ups up until he was 10 months old, and today he's cancer-free.
My name is Krista Young, and my son is Jordan Young, and he's 15, and he was diagnosed with aortic stenosis at the age about 10 months, and then had multiple procedures at Doernbecher, and a first open heart when he was 6, and a second open heart when he was 14.
And my daughter's name is Maylin Platt, and she was born 3 months prior to my due date, and so she spent that much time in the neonatal ICU before she was able to come home. So, knowing what you know now, what's some advice that you would give for families that are going through a medical crisis?
Did you want to? I guess I would say, trust your instincts if you feel like something is wrong, and make sure you follow up and advocate. I think that that's probably one of the biggest things that we all get busy in this world, and doctors too see a lot of children, and I think that no one knows your child like you know your child. You're the one that sees your child, every minute of every day a lot of times, and so and understands what's normal for them and what's not. And I think it's really critical to trust that and continue to follow up if you perceive that there's an issue happening.
Follow your instinct as a parent.
Yeah.
Krista, what do you think?
Oh, I'm sorry, the question?
The question is, knowing what you know now, what sort of advice would you give someone who's going through a medical crisis?
I would say, asking a lot of questions. I think just my biggest thing was there's so many unknown things, and I think that coming into a lot of the situations didn't know a lot. So I think doing your research and kind of educating yourself a lot and asking a lot of questions and getting different advice from different people and kind of helps you feel like you're a little bit more involved and that you're not kind of out there all by yourself trying to figure out something that you might not know much about. But I think the team of doctors that just having opportunities to talk with different people and different doctors and different nurses, and just making sure that you're asked a lot of questions.
So how do you know when you come in to a hospital and there's so many people that identify themselves as like, I'm Dr. So-and-so, or I'm the nurse that's taking care of Jordan or Bennett today? How do you know the questions to ask? Like, how do you know, do I ask the doctor this? Do I ask the nurse this? Where do you find your information?
I can say for me that I didn't know at first, who was who. I was, in a pretty dramatic situation and sort of confused about, who was in place and who was doing rounds. And so I just asked a lot of people a lot of different things. And sometimes would ask the same question to different people until I kind of understood. And then I like to do research myself. So then would try to, find those words that they just told me, online to have a deeper understanding, to propel more questions that I might have going on down the line. So there was part of it that was great with a lot of the doctors, especially Dr. Stork at Doernbecher, who took the time to explain to me the questions that I did have, and then utilizing that research some more to go beyond that, to find out what other things I might need to know.
I mean, really just, there's so many, Jordan had to go through such a complicated surgical procedure, so much medical care in terms of his medicines and follow-up. So what are some things that you sort of drew on to get yourself informed?
I think we did do a lot of research, my husband and I, just because that we had to make some decisions, and no doctor was going to tell us which decision that we were going to make. And asking them, well, what would you do if it was your child? They can't really say a lot of that. They can give us good, ideas and the pros and cons to everything.
Mm-hmm.
So I think for us, they've set us up with different patients that have maybe been in somewhat similar situations to speak with them about certain medications that he maybe would be on for the rest of his life and how that's affected, other children about his age. So I think that luckily we had a little bit of time to do some research and to talk with different doctors and different basically other patients that had kind of been in the same situation. So luckily we did have a little bit more. It wasn't like the moment crisis.
Right.
There was multiple of them, but there was a little bit of time in between there. So
That's a little different than what Bennett went through, right? Because you came to Dr. Linda Stork and you had this disease. He had this disease and you had to start treatment like right away.
Yeah, that first night, I'm not going to say there wasn't a choice. I would say that it was just, after they determined that his body was healthy enough to receive treatment, there's a lot coming at us in a short period of time.
Mm-hmm.
And so she basically explained to us, here's what's going on and here's what we believe and here's sort of statistically what they say, whether that is true or not, statistics, but we need to start treatment right away. And so at that point, I don't think I had the full understanding, but I knew enough that there was a sense of urgency to it, that and trusted in her and what they were doing, that I knew that it was essential that started ASAP. After that, obviously, asking their questions, but I did also find an online support group for parents who had infant leukemia, and they were a wonderful support group of people that had gone through it across the country, around the world, who could help answer some questions that sometimes, or answer or help better form questions sometimes too, just even regarding around diaper rash. I mean, that's a big one for kids with chemotherapy.
And the diarrhea.
Yeah,
Yes.
and so that was big. Like, what worked for you? And there's a lot of different products out there. Right. Some work, some don't. So some of those questions were critical just to helping your child through the process.
So it really sounds like you got a lot of help from the medical staff, so just like the physicians and the nurses. I can't tell you, at least when my child was in the NICU, how wonderful the bedside nurses were in giving information and taking care. But also seems like you found a lot of support from from other parents and other patients that have gone through this sort of thing. So I had a question. I see, I interact with a lot of children with cancer who go through a lot of treatment and spend a lot of time in the hospital. So they basically grow up in the hospital in some way. What are your thoughts about that in terms of a young boy spending a long part of their childhood sort of in the hospital? Does that?
I think every child is different, and I think that and you see that especially when we talk about the infant leukemia support group, that different children handle things differently. Bennett is at the age where he is almost 4, and he is seems completely like he doesn't have any sort of emotional issues from it. He hasn't quite reached survivorship yet, and so we don't, and when he does, he'll probably be the youngest one in survivorship. So just understanding the psychology of what happened to him, it's hard to know. Developmentally, a lot of times kids that are spending a lot of time in the hospital are delayed. So they're delayed in whether it's rolling over or walking or talking. They have feeding tubes, so just that can affect palate issues, etc. Or they'll have TPN. So for him, he was really lucky that he didn't develop any of those issues. But what I would say too is that parents just doing their best to keep things as normal as they possibly can, and to keep pushing through some of those. Not pushing is the wrong word, but to keep, being okay with moving their kids through some of those goals and towards some of the goals and towards normalcy. And that a lot of kids do eventually catch up with the right therapy and the right backing and support behind them. When Bennett gets older, he will go to survivorship, and whether or not there's some psychological stuff from just what happened to him between that age and 10 months, there's a lot of procedures that happen to a kid at that age. Whether that made his brain snaps differently, I don't think we'll ever really know what's him and what's not him.
But kids are resilient.
But right now, I feel like probably more affected than he is. I'm like, when's survivorship happening? When is therapy? Can I come along? Sure.
No, I remember because I can only speak from my experience. My daughter started out 3 months earlier in the world than she needed to be, and had to go through a feeding tube, had to eventually have a surgical feeding tube, and what are things we think about. And now she's 11 and she is in 5th grade and she is what we think is normal. That's what she would be. So they're so resilient, and I like the idea you're saying, like, you just expect them to be normal and then just kind of push them towards that way.
I think that's what they want to feel. They want to feel normal. I think I know that's for Jordan. Like, he didn't want people to look at him any differently. And if I learned anything from his interviews, it was I didn't want to be known as different or
right.
that had certain things.
Yeah. So I had a question for you, Krista. So Jordan has a chronic illness, as does Bennett. So we'll get there. But has a chronic illness. Again, he doesn't look like he has it, but he has to take medicines. He has to go to medical follow-ups. And how do you balance that with him being in 10th grade?
Yes.
And with you and your husband and other family members, like, how do you make that normal?
It's challenging, but I just kind of fit it in. He has to go get his blood checked every couple weeks, and he doesn't like it. But I just tell him it's kind of part of his process. He's got to get into a routine. He's got to make sure that he takes it. I mean, there's a lot of things that I have to start giving to him because he is in the 10th grade, and I'm not going to be around, to be able to remind him of taking those medicines and keeping up on the different things that he has to do in his follow-up checkups and
so really
that. But
empowering him.
so I'm trying to force him to do that a little bit more. Though it's me that worries about things way more than
of course
he does.
Of course,
but,
right.
That's where I'm at now. I'm trying to, he's got to be self-doing those
got to
things.
take some ownership of his own medical care,
Yeah.
which is hard for a young man,
Yeah, they do, because his brain isn't thinking about any of those things. But he's starting to. He's starting to be. I'm having to remind him less. And, but it will be something. I mean, for the rest of his life, he's going to have to continue to follow up with.
And with Bennett, yes, I mean, you can be cancer-free, but you always have that concern. And so how do you balance that in your life, knowing that you have a child that went through cancer, and is there a chance it could relapse, or like how do you live with that?
I think kind of going back to the first question, which is some of the things that you take away from having a child or find out your child has chronic illness. I think one of the first lessons that you learn is that you have to take everything one day at a time and sometimes 1 minute at a time. And so, and just be very much in the present and not get too caught up in statistics and other things that you're here right now and your child is safe right now in this moment. So be in that moment with your child. That's not always easy to do when your child is going through a chronic illness, but reminding yourself that is pretty critical, I think, to your sanity. And so in Bennett's case, he is 3 years cancer-free, and yes, there's always a chance of relapse. One of the side effects of AML is AML, possible, but it's so minute. So there's those things in the background of your mind, like, well, it was a 1 in 5 million chance in the first place. What are the chances of relapse? He's got a heart condition, cardiomyopathy from the chemotherapy as well. And so, those questions do populate in my mind about what will happen in 30 years, from the toxicity of the chemo on his body. And, like I said, I just kind of take it back to, we're here right now, everything's good right now, and I'm not going to worry about something that could happen 10, 15 years from now even. Medicine's constantly changing, quality of care, understanding our genetics, understanding the different things that we can do to help kids, whether it's possibly in our heart or other things that might come up with, are also on the possible horizon. So I think that for me, it's just I'm enjoying where we're at. Not saying I don't have my moments, but for the most part, it's cancer is no longer a neon sign in my brain.
Right. Right. Still back there. We all multitask. We all compartmentalize.
Yeah, it's just not on the front
Right,
blinking
right,
anymore.
right.
So
And I think it's so important what you said, the living in the moment, because every day you're like, oh my goodness, at least for my child in the NICU, it was like, what was her oxygenation saturation? What's her blood levels? And what is it going to be in 2 days? What's this going to mean when they do the next test in 2 weeks? And just to be in the moment, just to enjoy your boys and my daughter just at that time.
Absolutely.
Was there a particular, I know I'm raising a lot of hard issues, I'm so sorry, a particular time in which was really difficult, like just, was there something a moment that you remember, and how did you get past that?
I would say one of the hardest moments was just when Jordan was older, going into the second one, with the questions that he had. And I don't have a lot of answers because there's a lot of unknown. There's a lot of unknown when you go in and what that's going to look like.
And he was looking to you.
Looking to me for that. And trying to be a support for him, trying to be strong, trying to be understanding of his feelings, knowing that for him to express how nervous he was and how he wasn't sleeping. I would say that was probably one of the hardest moments. Just letting him go in there and just not kind of that unknown, just knowing that he was kind of what he was going through.
Right.
And I think that was probably the hardest
thing.
Yeah.
Just knowing that he was uncertain and you were both scared.
Right. Like, there's nothing I could have said to him, or no, I couldn't say what's going to be. You can't. Right. It's going to be. I don't know what it's going to look like when you come out, or what that's. How you're going to be feeling. And he had. A lot of feelings that were coming up from the previous surgery. So he was kind of going through a lot at that moment, and there was only so much you can do as a mom.
Right.
And I think there was.
He's not young enough to say that. Oh, it's going to be
It's
fine.
going to be fine. He knew that if I said that wasn't the reality. I mean, I did. I told him it was going to be fine. It was going to be good. In that moment, it was. But you don't know.
Right. For you with Bennett, I mean, obviously that first night must have been just so hard, or were there?
There were lots of really very intense moments that would be very difficult for me to talk about in detail. But what I will say is that, overall, with a child who can't communicate is very, very difficult, because there are so many times you're not sure what kind of pain they're feeling, what's actually, they can't describe their symptoms to you. I think that is, especially in a new mom, mentally very taxing. Emotionally, being prepared for that, and having someone to talk to about that is pretty critical. And so if you have someone in your hospital, in the hospital, which I know Doernbecher does, to speak to during those occasions, I think it's probably good for you
and
to
did you
reach
have
out.
someone? Did you have a particular physician or a particular social worker or nurse that you bonded with?
If I could say anything to anyone, it would be that, going in there, I had such, my world at home was so tight, so like going into this room and having people come in and out of my room was so intense for me, having a new baby, that I didn't want people coming in my room. And so I think I lost a lot of services that were probably pretty valuable to myself. In hindsight, I can see it now, but at the time it was just so traumatic. And so I was trying to normalize things by keeping people out. And later on, I did end up going and talking to someone, and it was right before transplant, and so I ended up going and just having a conversation and dealing with some of my anxiety issues at that time. And so I think that's critical too, if you're dealing with that, to be willing to consider all the options for yourself, because you're the primary caretaker and you have to be healthy too.
Right. Yeah, it's so important. People tell you, the nurses will tell you, like, you have to take care of yourself, self-care. And it's so hard because you think you have to be at the bedside all the time. Like, if you step out and something were to happen, you come back in and they couldn't find you. But if you don't take care of yourself, then, like you said, who's going to take care of your child? So how are they doing now? How's Jordan doing? How's Bennett doing?
He's doing really well.
Yeah.
I think it's been, we had some rough time after. It was just some stress things that he was having recurrent moments, I think, just kind of like that PTSD kind of coming. So that was pretty challenging. But I think we're over the hump on that so far. I'm sure he has triggers, but nothing that is, through the night, different things like that. But he's thriving. Yeah, he is. He's playing sports again. He tried out for the basketball team because he never was able to, and he was able to play. He made the team, so he's been able to do things now that he didn't get to do before.
And how's Bennett doing?
He is very silly and very high-spirited and very smart, and we're in trouble.
Yeah.
Yeah, for sure. He's definitely, I mean, his spirit has shown through from the first day that we got him into the hospital through now. He's always been very strong-willed and independent, and I think that's a lot of what kind of got him through this process, and definitely that vein still runs through him right to this day. So he's doing great. Like I said, we are down to once a year visits, and so I think this next May he'll start survivorship is what I'm told. And so he's already seeing the cardiologist, which is and his heart's doing really well right now. So we couldn't, I think for us, we feel very blessed to be in the position that we are in. We know specifically with this illness that it doesn't always end up this way for everyone. We're celebrating in that.
Good. That's very nice. That's very wonderful. Do you have anything that you wanted to tell mothers or fathers or caregivers going through something like this at Doernbecher? Any words of wisdom?
I think just for me that I would say that there's a lot of great doctors at Doernbecher, and that finding, a lot of times you get to choose your doctor, making sure that you can communicate with your doctor, that you're not afraid to advocate, that you have that great relationship. I really felt like I had that with Dr. Stork from the beginning, and I know other people who had that great relationship with their different oncologists, and in the background they work as a team oftentimes. So if there's someone that you particularly communicate with better, no one's feelings are hurt. This is about you understanding what your child's going through and being able to help in part of the care process.
So understanding that you have someone who's identified as your child's primary, such as Dr. Robin Shaughnessy, who's Jordan's cardiologist, but knowing that there's a team with that person, not only cardiologists or oncologists, but the support services behind them, the surgeons, the nutritionists, all these people behind. Anything that you can think of you'd want to tell
I think
someone?
that's great advice. I think communicating, I think that's really big, and asking questions, and never feeling like I've never felt, every nurse and every doctor is always willing to take the extra time to explain or sit with you, or I think that they're great support, and I think to utilize them in that is very important.
Yeah. I still made sure that I was a parent, that I was a mother. I tried to make sure that they talked to me as if I was that, not try to assume that I knew things about neonatology or being NPO and things like that. So I had maybe a better understanding of the nuances of the words they told me, but I still tried to make sure that they talked to me as a mother. And oftentimes my husband was with me, so I wanted to make sure that they spoke on a level that we both understood. So even though I was a physician, I really tried to make sure to the medical staff that just treat me like a mother.
What advice would you give to parents then, having been on both sides of things? Are there things that you would say that you did do, having that experience as a doctor, that contributed and helped in the overall situation, just because you knew sort of how the whole thing worked?
Right. Yeah. I say that you should really trust the people that are around you, knowing that you can advocate, that you can speak up if something doesn't seem right, but having a lot of trust. As a physician, I didn't know about neonatology or what it meant to have a baby that was 3 months early, but I trusted them, that the doctors and the bedside nurses and the medical students that took care of her would know a lot. And so that really was something that, as a parent and as a physician, I tell families, you can ask all the questions you want, but there also has to be trust in the medical team. And then it's interesting because the flip side of it is that being a physician and been a parent on the other side of the medical field, I've learned that, and this is going to sound funny, how frustrating and difficult it is to navigate the medical system. Even just going from like the cath lab to parking, or going from the clinic down to where pharmacy is. It's very difficult, literally, to navigate the system, as well as figuratively trying to say, I don't understand why insurance won't cover this, or what can I do in order to move the cardiac cath appointment to a different date. And so as a physician, I think that's made me more tolerant, more kinder, because I see that it's very hard. Even someone like myself who has a medical background, how hard and frustrating it was to navigate the system. So we as physicians and medical people have to be kinder to people that are coming into our world. So that's what I was thinking. Okay, so change of topic. What were some things that you did for fun that got you through the times? Like something that you or your family did at home, or maybe while your child was in the hospital, that sort of lifted up your spirits?
Kind of music is our big thing. It's a thing in the family. We always have it on, or we're singing, or somebody's rehearsing something, taking some skit, or it's your turn to sing that, set of the lyrics or something. But I would say in the hospital probably there was a lot of talking about kind of what it was like, some places, like a lot of, like Jordan likes a lot of outdoor stuff, so it was searching on different hikes and different things that he could do. It kind of took him to that place that I think he could clear his mind. So we did a lot of research on the iPad with just trying to find where are we going to go next, and
sort of planning your
vacations a little bit
Nice.
ahead of time.
Okay.
But music was a big one. I think some of the doctors came in with like a ukulele and they taught him how to play it and sitting in there, which I think was extremely therapeutic for him. Just anything that kind of takes their mind off of that. To watch a lot of movies, just anything that feels like it can be somewhat normal, like things that you would do if you were at home. But yeah, lots of
music. It sounds like lots of music. Yeah,
that helps.
Yeah. I recall, I didn't. Myself or my husband spent a lot of time in the hospital, or our daughter spent the time in the hospital, and we'd see her a few times a day. What we found therapeutic was trying not to talk about her when we were away from the hospital. We were new parents, and we could spend time at the bedside talking to the nurses and the doctors, and when we left, we would talk and digest everything, and then after a while it felt like our conversation was all about our doctor and not about our daughter, and not about our relationship. And so, I don't know how it felt for you, and maybe I'll share it, and then you can pick up on it. Like, that was very hard to keep that relationship between my husband and myself, and not always tie in my daughter that way. And how did you manage to keep your relationship with your partners intact while still having to deal and concentrate on what was going on? Is that too personal?
No, I think it's an evolving thing. I think this is something that's, if you're lucky enough to have a support system and someone to go through something like this, and it can be a partner, it can be family members, it can be really taxing. You're going through some of the most difficult times in your life, and you'd love to think that you're always going to be Mary Poppins through this, but quite frankly, you're not going to be. You're not going to be perfect, and you're going to have times when your pain gets to you. And so I think in a relationship, just so understanding that, they say, find time for each other. I think there's times when you're not going to be able to find time for each other, but as long as you have that, I feel like in the back of your mind that's a priority to you. I think that's and then that your relationship is a priority, and that support system is a priority for that child's health and well-being as well. I think the best thing that you can do is, first support your child, support yourself, and then, support your marriage or your support system and relationship in that way. And that might be, for us, individually seeing a counselor, it might be seeing a marriage counselor, whatever you need to do to kind of help deal with some of the anxiety and some of the other things that come out of the situation. And then being able to take it, like you mentioned, a date night once in a while.
Right.
So even though we were in the hospital, we'd be in the hospital for a month. Sometimes my husband and I would switch off. We'd stay together in the hospital in that little twin mattress. And then sometimes we'd switch off and I would go home for a night and just have like a night at my house with my dog, and vice versa for him.
Hold that to yourself.
Yeah,
Right?
yeah. And then, once we kind of got to a safe space with Bennett where, he was his ANC, his white blood cells, his blood was coming back, and we felt like he was a good place where he could maybe fight off infection and those kind of things. Then Grandma and Grandpa would come in for the night, and Ryan and I would go home, and we kind of did the same thing. We already done all the talking at the hospital.
Right.
So this was a moment for us to just have that mental vacation with each other, to just be with each other.
It's so important. Is that something you feel comfortable addressing?
Oh yeah. I think that I think it's a great point. It's a conscious thing. You have to make sure that you take the time to do it. And I think having a support system, whether that be family or just a friend that comes in, just that, we were blessed to have that, where they would come in and just, even if it was taking a walk around the hospital or going and having lunch outside of the hospital, or something. But yeah, it's definitely something you have to make sure that you do the time, because it can be overwhelming, and that can be the only thing that consumes you. It just takes everything, and you're constantly thinking about what if and this. And I think somebody at one point, one of my friends said, it's okay, like, if you're not there and something happens, it wouldn't change. You can go to take your time to go take a shower and do the things you need to do, because you being there, yes, you need to be, but it's not going to make the biggest difference if you're there or if you come back in an hour.
Yeah.
I think that it kind of hits on the point that we were talking earlier, where, taking support when it's from family and people when it's offered, taking help when it's offered. So for me, it was literally someone, they took care of my dog, and they'd come up, and maybe a nurse or my mother-in-law helped a lot, watch Bennett for an hour, and I would literally go take a walk, with my friend, and we talk about all sorts of different things and everything, but not the hospital. Or it might be, Child Life Services coming in and having that moment to talk to someone, like you had mentioned, which I didn't do well at.
It's hard in the moment, because it's like, I don't want to talk to a stranger, but I found that it was probably one of the most helpful things for me, because it isn't my spouse that I'm breaking down or having my moment with, and it's somebody that has a little bit more perspective, somebody that speaks to other moms that have been going through something similar, and they just have, they seem to have a great presence about them, and they have good, just their advice and their words.
So this was someone through the hospital that...
Yeah, they come in like right before or right after they went back for surgery or something, and they can take you into a room, and you just get to have that time for yourself, and nobody's watching, and you just get to kind of have your moment and have that support that I think asking for help. And I think, any sort of support system, friends that bring in, friends that just brought in magazines that I was like, I would never buy this at the store, but it makes you not think about things in that moment, and bringing things from home for the kids that make them feel, so there's a certain blanket that made Jordan feel like he was in his own bed, because it's not how they feel when they're there, but if you can try to provide them with the most things that make them feel comfortable, that you can. It's hard.
And I know for me, at least in the first 2.5 months of my daughter being in the NICU, I thought I held it together. And then one thing happens, it was a small thing, she had her usual weekly eye exams that they make sure that the eye is developing appropriately. And I had never seen this done before, and but afterwards you can imagine a small baby having their eye exam, they're like exhausted. So when I saw her shortly after that, she was pale, she just looked so stressed out, and I just broke down. I just broke down. After 2.5 months, that was the one thing that tips you over, And so I had someone come over and said, you should probably talk to someone. And so at least through the hospital, we have services for the medical staff, and so I went and talked to someone. And you don't want to get to that point that you completely fall apart and then, but at any point when you feel like you need help, you should reach out, and it seems like you guys do that, which is great.
I think that's a good point, because you said that I think it's so hard to, you're trying to be strong and hold together in the moment. You're trying not to leave that room for more time, and it's hard to talk to the stranger. But it is that thing that these illnesses, they do cause a tremendous amount of anxiety. And I was thinking about you don't necessarily walk in with all the tools that you need to deal with that anxiety. So, in hindsight, if I were talking to myself, I would would say take advantage of that person when they come in the room, find out what tools they have to deal with the things that you're going to face, because the sooner you can use them and learn those things, the better stronger experience you're going to have, and the better you're going to be able to handle this, not just now, but in the long run after the treatment is over with. When you still have other ways that this kind of comes out of you, which surprises you sometimes, whether it's worrying about maybe your own illness now, or just kind of helicoptering in certain ways. I find having to pull back a little bit, and other things sort of trigger that anxiety now. Bennett has a cold, and the cold isn't just like the cold that he had before. So is this the one where he, so.
Yeah, I think recognizing that you need help, that you don't always have to be strong, and sometimes in the excitement of the first diagnosis or the first abnormal echo, you just you have tasks, you can get through that, because we do that, and then once the excitement dies off, and then you really realize that this is a big deal. I think at that time, recognizing that you can reach out for help, even though things are like manic and you have life and death situations, you still need to deal with the rest of what's going on with your child. So.
Sometimes it's those smallest tasks, like making sure that you eat. Like you can think about that, right? That you're walking, or that you're just those very simple things that you didn't think about to do for yourself, right. But you realize you have to be able to take care of everybody else.
I can't say if there was ever one single piece of advice. I think it kind of goes back to the things that we've already touched on, which is, accepting support and help when it's offered, and especially in those critical times and critical situations, seeking self-care for yourself and advocating, knowing that no one knows your child quite like you do. And so working with the doctors, helping them, and by, advocating for your child, for what you're seeing going on and what you notice, because you're the one who spends the most amount of time with your child. So I don't think it was any one particular piece of advice that I received, but just sort of things that I learned along the way as people kind of indicated them to me.
Yeah, I think it's sort of the same thing that Shelby is saying, is that just, understand that you need help, ask for it, ask lots and lots of questions. And the one thing that I did too, it wasn't a piece of advice, but I took a lot of pictures, mostly the good times, none of the bad times, but I took a lot of pictures in the hospital, because this was something, at least for my daughter who was really young, to share with her what she went through. And with Jordan, with his first heart surgery, or Bennett, maybe when he went through the first couple days in the hospital, just to show them what they went through, how strong they were, and so that was something that wasn't a piece of advice that I had gotten, but I did take a lot of pictures, and I realized that, oh my gosh, those are the things that we could look back on, and how strong we were as a family, and it was a nice thing. So I took a lot of pictures.
I did do that as well.
Yeah, the ones that we have, we definitely look back on a lot, especially the visitors, the people, friends that come, things like that.
That hung around the hospital bed, and everyone.
Yeah, and because they each bring something, and usually that's in the picture. Bring something, but just they do little things that try to uplift, bring in their favorite food or drink or something.
Thank you so much for your time. It's been wonderful to share this experience with you. We hope that this really helps the other parents that have to go through such difficult times.